Hey, so I have actually had this question a lot and thought it would just be easier to do a story time on that. There's a lot more to the story. We went through IVF for years. We were married for 13 years before we were able to have our child. So if anybody's struggling with fertility issues, we've been through a lot before we were actually able to. So I know you can feel alone sometimes when you're going through that. Let me know, reach out. I would love to talk to you about that also. So, but back to my daughter. When she was born, we didn't know there was anything wrong with her heart. So shortly after being born, she was life flighted out to Norton's Children's Hospital in Louisville, Kentucky. And not long after, upon arrival, they discovered that she had what's called truncus arteriosus, a severe leak in her aortic valve, and her pulmonary artery was narrow. So at 6 days old, she had her first open heart surgery. At 2 years old, she had her first stent in her pulmonary artery. And then at just the beginning of being 4 years old, she had her stent expanded. And then at the end of being 4, almost 5, she went in for what was supposed to be her second open heart surgery. But due to complications, within a week, she developed a blood clot that was pressing on her heart and her chest wall. And so we went back in, and she went in for her third open heart surgery. And after having that one, we had a lot of complications before she was ever even able to make it out of recovery. They immediately took her back in for her fourth open heart surgery. So with truncus arteriosus, we're born with 2 main arteries. She was born with 1. So they had to add a conduit in, and a conduit can be a human donor, man-made, or a cow piece. They were able to use a human donor the first time, and since then they have been able to use a cow part. So that's kind of interesting what all they can use for that. But she's not done with her open heart surgeries. As she grows, that piece does not grow with her. So as she grows, we have to keep having it replaced. And then her aortic valve, having a moderate to severe leak, will at some point require a mechanical valve. We're not there yet, but we are getting close. And we know that. We're keeping a close eye. We go to the cardiologist quite often. But if you have any other questions about what this was like, or if anyone's going through anything similar, reach out. I know with all of this, you can feel so alone at times, and I would be more than happy to help. But thank you for asking, and have a blessed day.